I was born in the mid-'70s to a black dad and a white mom, not more than a decade after interracial marriage was legal. I could see the difference between how my father's family had access to housing and how my mother's family had access to housing. People experiencing homelessness here are at 38 times more likely to die from the cold. We took care of a lot of folks who lost fingers and toes and below-the-knee amputations. The average age of death for a person experiencing homelessness is 56, so a full 18 years earlier than the general population.
If we created new benchmarks, I think it would be so productive.
When we talk about ending homelessness, I really thinking about how can we bring rates of black homelessness down to rates of white homelessness. If we can do that, that's how we get there.
Today on the podcast, I am so honored to sit down with Christine Haley, Chief Homelessness Officer for the state of Illinois. And what she shares is so powerful. Christine opens up about growing up in a biracial family and seeing housing inequality firsthand. That personal experience drives her work today, leading statewide efforts to prevent and solve homelessness. We talk about why homelessness is rising in Illinois, how rising rents and structural racism are pushing more people into crisis, and why black people are being hit the hardest. She breaks down redlining, wealth gaps, and the bold solutions Illinois is investing in, like eviction prevention, medical respite, and building a real safety net. If you care about housing justice or just want to better understand what it really takes to solve homelessness, this episode is a must. Please watch, listen, and share. These are the conversations that can change minds and change policy. Thank you so much for joining me. I got to tell a little story because you made my day. When I'm emailing back and forth between you and your communications person, you responded, "Oh no, I already listened to his podcast," and here we are.
Yes.
So tell me a little bit about yourself.
Sure. Let's see. So I am of the first generation of people born after the civil rights movement. I was born in the mid-'70s to a black dad and a white mom, not more than a decade after interracial marriage was legal in the United States. So my childhood was one of movement. It took a while for my parents to find a community that was welcoming to an interracial couple in the 70s in central Illinois and then in suburban Cook. So my parents are from Peoria, Illinois, in central Illinois. I grew up in Cook County. And I think as a kid, I was always interested in housing because I could see, the difference between how my father's family had access to housing and how my mother's family had access to housing. My dad grew up part-time with his grandparents and then part-time with his mom and his siblings in public housing in Peoria. And my mom, her parents were able to purchase a home. My grandfather was in World War II. We were able to purchase a home. So I was just always interested in why are things so different between my two grandparents' homes? And I just saw even, 4, 5, 6 differences between race and housing and neighborhoods and housing. I didn't understand it, but over time, I grew to understand it and have wanted to learn more about it. And that's, I think, my racial justice frame in housing has been because of how I grew up.
So you manage the state's response to homelessness.
Yes.
How long have you been doing that? Because that's got to be a very rewarding and a tough job.
Yeah. So about 3.5 years. So in 2021, Illinois Governor J.B. Pritzker signed an executive order to fight homelessness, which creates an infrastructure to address homelessness within state government. So we have an interagency task force on homelessness, like many other states do, based on the U.S. Interagency Council on Homelessness. So I serve as the chair of the task force. We have about 16 state agencies, plus our Governor's Office of Management and Budget. So that includes, our Housing Finance Agency, Child Welfare, Human Services. It includes our Department of Corrections, Juvenile Justice, Board of Ed, and Higher Ed. And the role of the task force is to align state agency strategy and funding around addressing homelessness. We have a community advisory council on homelessness that provides guidance to state agencies on how to do a better job in supporting people experiencing homelessness. So that's made up of people with lived expertise, people who are from advocacy organizations, service providers, local government, continuums of care. And I serve as the co-chair of the advisory council along with Emily Krishunas, who's with Chicago Funders Together to End Homelessness.
Yeah.
And then we have a state office to prevent and end homelessness. And so right now we have staff that are embedded in multiple state agencies that are part of the leadership team of the office. And so they are at the Department of Corrections, Public Health, our state finance agency, Housing Finance, and Medicaid.
Yeah. What's happening, and I'm going to speculate here because homelessness is growing across the country. Mm-hmm. So I assume homelessness in Illinois is also growing.
Yeah. So homelessness from our 2023 to 2024 point in time counts grew 116%. The majority of that growth was because new arrivals from the southern border were bused to Chicago. So in that
wow,
we had...
I didn't even think about that. This country has an immigration crisis. Mm-hmm. And for whatever reason, I would say they're stuck on stupid and ignorance and hate. But that's my personal opinion. They started busing migrants to different communities, and Chicago was one of them.
Yes.
And it put a burden on a social services system that's already been taxed. Do you feel like, can you talk about that and the burden and you know, I couldn't imagine what Chicago and other cities, people like yourself that are working to help people, and then all of a sudden busloads of new homeless people show up.
Yeah, it was a very difficult time, I think, because there were so many families. So in Chicago's homeless population is overwhelmingly single adults, who were arriving were primarily families with children. It was like opposite. And so I think that part of it was the just sheer volume of people, and it was very concentrated. You can tell when a bus arrives, you know exactly who is experiencing homelessness because a bus pulls up, or people were flying into O'Hare primarily, right? So it was buses, flights, where on the Chicagoan side, it's not as clear who is experiencing homelessness and who comes into homelessness. So at some point, there was the same number of unhoused Chicagoans that were falling into homelessness every day that there were migrants coming in every day. And I think that the challenge was, one, just shelter space, you know, and we had an emergency order to be able to open up shelters. But that now that new arrivals are no longer coming and populations have come down, part of what my office led was called the One System Initiative. Because what Chicago did is it created a separate shelter system for migrants than for people experiencing homelessness. And so part of our job was, if we're building all this capacity for shelter, we need to figure out how to maintain that capacity for all people. Right. So in January is when the One System Initiative, or the One Shelter Initiative, One Shelter system launched. So now across the shelter beds in Chicago, anyone can access them. There's no longer migrant shelters and homeless shelters. It's everyone has access. And over time, we have it in our proposed state budget to continue. About 5 of those shelters will remain. So many of the migrant shelters have closed because we don't have folks. But what we were able to do was to maintain another, that will maintain at least 3,000 shelter beds in Chicago that wouldn't have been created, if this hadn't happened.
As homelessness grows, people are getting frustrated, and they're pushing for laws that criminalize homelessness, which will only make the problem worse. Invisible People reaches more people, educating them on homelessness than all other homeless sector nonprofits and campaigns combined. But we do it on a limited budget. We don't have the funding they do. We are mostly funded by individual donations. And now that the economy is struggling, individual donations are disappearing, and we need you. I get it. You might not have the money to donate. Many people are struggling right now. Please share our content, share our videos. It really matters. And if you do have some funds and want to help be part of the solution to solve homelessness, please visit invisiblepeople.tv/donate. Our important work stops without you.
So new arrivals are part of our homeless counts. So Chicago's point-in-time count grew over 200%. But even if you look outside of new arrivals, we have 19 continuums of care in Illinois. And of those, 16 of the 19 had increases in homelessness. 6 of them had increases of over 40%. So that really had nothing to do with the new arrivals. It was really about what we see as increases to fair market rent. So in Illinois, since the pandemic, we've seen increases of upwards of 40% in fair market rents, and that's how we understand the increases.
And that's what the public doesn't understand or doesn't want to understand. For every $100 increase in median rent, homelessness goes up 9%. Mm-hmm. People want to blame it on addiction or mental health, but it's really, we have a housing affordability crisis that would also help people in addiction and mental health.
Yeah. So, we are really looking at trying to understand what are the structural drivers that cause homelessness and what are the ways in which we can really look at root cause. And a lot of the foundation of our plan, racial equity is at the core of our plan. So Black Illinoisans are about 14% of Illinois' population, about 30% of those experiencing poverty, and 61% of those experiencing homelessness. So I'm, my first job out of college, I actually worked abroad for a few years and worked in homeless services abroad, and then moved back home and worked with families that were experiencing homelessness through a home-based Head Start program. And my job was to accompany families as they move from place to place in that time. And this was in 2000, 2001. Families, continued to bounce around from shelter to shelter. And in that, I noticed that in almost every shelter that I went into, almost all of the families in that shelter were Black. Yeah. And here in Chicago, Black Chicagoans are about 30% of those who are 30% of the population, yet 90% of those experiencing homelessness on the family side.
90% on the family side.
On the family side, not including new arrivals. So then, not including new arrivals, and so 90% Black. And I saw that, and I just didn't understand why we allowed this. And so I, at that point, really wanted to dedicate my career to focusing on getting to root causes of why we have such deep racial disparities in homelessness here.
So can you explain some of these root causes, but also continue on what can we do about it?
Sure. So we worked with the University of Illinois at Chicago's Institute for Research on Race and Public Policy to create a document called Black Homelessness in Illinois, Structural Drivers of Inequality. So I think one of the first things about it is thinking about income and wealth, right? So if you have a housing crisis, we have a housing crisis, where do you pull cash from to get through that crisis? And for many people, they either have cash in the bank or they can pull from their home, right? Pull equity out of their house. And, Chicago has, and I'm going to focus on Chicago.
Oh, please.
Chicago has a deep history of redlining and also contract selling, where if you saw Ta-Nehisi Coates' article in The Atlantic about reparations, it talks about contract buying in Chicago.
Can you explain?
Sure.
And some people might not know redlining.
Yes. So I think that part of this is where government-backed mortgages were allowed within certain neighborhoods. And so surveyors would go out to a neighborhood and say, no, these are the areas that it is not a good investment if to invest in mortgages. And they would, you can see maps. And a lot of the maps that across communities, there's a red line around neighborhoods where it's not a good investment, that we're usually Black, brown, and we're Jewish Americans.
And it was
lived. Intentional government programs, right?
Right.
And so I think that there's a history of that. And, Chicago, we're in one of the most racially segregated communities in the country still. I think there's that. In addition, so as Black folks didn't have access to traditional mortgages but still seeked housing, would be able to purchase under contract a home from a white seller. And in that, it kind of feels like a rent to own, where you're completely responsible for the maintenance of the home, completely responsible for the upkeep and for payment. And if you miss a payment, you lose all the equity that you've put in. You've all that payment towards it. And Duke University in 2019 did an evaluation, an assessment of contract buying in Chicago, and found that between $3 and $4 billion was stolen from Black Chicagoans in the 1960s and 70s. Right? So if we understand that history, then we look at our current lending. So in 2020, our local national public radio station did an assessment of where do Chicago banks lend for mortgages. And they found that there was more investment in Lincoln Park, which is a predominantly white neighborhood in Chicago, than all Black Chicago combined. And there was more investment in West Town than all of Black Chicago combined. So and then there was another neighborhood. So there were 3 neighborhoods in Chicago that were predominantly white that had more investment themselves than all of Black Chicago combined. So when we think about what is access to capital, we understand that that is something that isn't in the past in 60s and 70s. This was a study that was concluded from 2017 to 2019.
Right.
But I found that what was interesting is that in the homeless side, we weren't talking about this, right? As this was going on, we weren't having conversations about what was happening on the homeless that. And so that's been part of our work, and why we brought together the Black Homelessness Roundtable was so that we could bring Black leaders from across the state, right? So people who were service providers, folks with lived expertise from leading public housing authorities, leading libraries, to really be thinking about what is it that we want to recommend, and how do we understand what to do around addressing the disparity. And so I think part of it is, these big picture pieces on home ownership, but it's also about income and assets. So there was a Color of Wealth study that came out around Chicago incomes for data from last year, that found for liquid assets, how much cash do you have on hand? The median liquid assets for Black families in Chicago was $1,000, and for white families it was $27,000. And if you think about still how segregated our communities are, if you have a crisis, who do you go talk to? You talk to your family and friends, right? And if they are in the same socioeconomic situation that you're in, and also only have $1,000, they can't help. We also know from our programs that we have for homeless prevention, right? If you are in need a resource and you call the Chicago and Cook County Homeless Prevention Call Center, only 1 out of 8 people who call actually get a resource, right? Either because there aren't enough resources at the time that we call, or there isn't enough capacity to process the applications. Many folks are eligible for the resource. So I think that that's where we see the housing, that's where we see how families fall into homelessness, right? Where the dominant narratives still are around bad decision-making, mental illness, substance use. But for us, we're really trying to change that narrative to think about the structural piece.
I always say if homelessness was a punishment for bad decisions, we'd all be homeless.
Exactly.
So how do we fix it?
Yeah. So part of what was asked of us when we created the Black Homelessness Report was for us to have an action plan attached. So the report itself has a series of domains. So one is looking at evictions. What are rates of evictions? How do we reduce evictions? The second was looking at incarceration rates and how do families become homeless? So as incarceration rates go up and down, we saw parallel rising and fall of Black homelessness rates. So how are we able to support families when...
Is that because of the person who... the breadwinner, I don't know where that phrase ever came from, but, the person that's bringing revenue into the family that can pay for rent is now locked up?
Exactly.
Could be.
So I think that that's the piece where we've got evictions, criminal justice. I think another area is around child welfare and how, youth aging out and how disproportionate child welfare involvement is in Black communities. And then I think the other domain for us has been around unemployment and unemployment insurance. So really ensuring that people have access to unemployment insurance. The system in Illinois is a mail-based system. So if you are eligible for unemployment, you would get a letter through the mail. And if you don't have an address, how are you going to get that letter, right? So I think part of it is we're doing work to understand how we are better serving people experiencing homelessness who may be eligible for unemployment.
That little bit of income that unemployment pays could be a world of difference.
Exactly. So that's just different areas. That the main intervention that we made was with the court-based rental assistance program. So we had a court-based rental assistance program for people who were in eviction court that would pay back rent and then a few months forward. And many states have that program funded through ARPA, and then once that money went away, those programs ended. But we had a $50 million investment for the implementation of the Black Homelessness Report, and our General Assembly increased that to $90 million, and the bulk of that funding went to court-based rental assistance.
Wow. As you were talking, and this has been coming up in my mind, I haven't been in Chicago since before COVID.
Yeah.
Beautiful city.
Yes.
During the summer. I used to do these road trips, and I would travel around, and there was Muhammad, and we're at the Sheraton for the CSH conference, right on the loop, and right over here on Wacker, I met Muhammad, and he's an African-American, and he was panhandling, and he has one arm.
Yeah.
And I interviewed him for Invisible People. I came back, I don't know if it was the next year or 2 years later, and he was still there. I'm sure he didn't just stay in that spot, but I got to interview him a little bit more, and it really hit me because he's unemployable. So he did 6 years in prison, so he's a felon. So at the time, this might have changed, might not have. The state of Illinois did not provide welfare to single individuals. And SSI said, you have one arm, you can work. But who's going to hire a black man named Muhammad who has one arm and is a felon? And it really struck me because he didn't have many choices. He probably made $25 panhandling over a couple of hours that day. And he could either commit crimes, and that could be drug dealing or robbing purses or whatever, or panhandle, where he's only, how do you survive off $25 a day? And our documentary is premiering. We're partnering with CSH. So we did a documentary on prison reentry to supportive housing and saw how important it was. And Muhammad still sticks with me today because, when you look at the populations of people experiencing poverty. And then you have, ageism, different types of discrimination from whether it be sex or race or sexual orientation. That, there are people that can restabilize and go back into, employment. Or there's people that can find employment and restabilize. However, there's people like Muhammad who deserve housing. There's no way he can restabilize. I mean, I would imagine he could have a very thriving life if he was able to find housing and, support and, a community where you're living outside. And at the time, everybody slept lower Wacker. I don't know if that's still the thing.
It is.
I would assume so. Not a lot changes, except it gets worse. And I don't mean to laugh, but if you don't laugh, you're going to cry. So Muhammad's story really stuck with me, and right when you said black homelessness, because right out this window, I can visualize talking to him.
Yeah, so I think in thinking about Muhammad, I really think about the intersectionality that exists across people who are experiencing homelessness, right? So you talk about all the different pieces of ourselves that we have, and the importance of housing first. I think that with the shifts that we see at the federal level, that where Housing First could be under attack. For us, we are a state that believes firmly in Housing First, and also in connecting that to employment first, right? And how are we able to think about not only what housing supports folks might need, but also what employment supports folks may need. You know, I am a parent of a child with disabilities, and in that, we talk about employment quite a bit in what it is that she is looking to become and what support she needs in employment. And I think that within the Illinois Department of Human Services Division of Rehab Services that really focuses on employment, I think we have work to do in bringing these worlds together. But I think that it makes me think about just the vulnerabilities that people have in our state that we identified through data through our state's first morbidity and mortality report. So the Illinois Department of Public Health last year released our state's first morbidity and mortality report, where we found that the average age of death for a person experiencing homelessness is 56. So a full 18 years earlier than the general population. And that there are a number of reasons. One, that we looked at as we talk about the cold are cold-related injuries. So my job before I worked for the state is I worked at the county hospital for Cook County Health and Hospitals, and my role was really looking at how do we support our patients who are experiencing homelessness.
Wow, because first off, I was going to ask, what did you do before?
Yeah, so I'm an administrative social worker by training, but have primarily worked in more administrative jobs. I think when I talked about when I worked with families that were experiencing homelessness when I was 24, I realized that it really hurt me so much to see the violence of our systems that I was like, I can't really be in direct service roles in that same way. I needed to work more.
I gained 70 pounds.
Yeah, it's painful, right? It's painful, and I wanted to figure out how to still dedicate my life to the work, but just not in a direct service role. So I've kind of gone back and forth between working at CBOs and then working in government. So at county, I worked primarily with people. During the pandemic, we worked with folks who had COVID who were experiencing homelessness. So we opened up medical respite programs for people who were experiencing homelessness, primarily those who had COVID. But then after the COVID numbers dipped, then we took folks, and many of whom in the winter who had frostbite. So people experiencing homelessness here are at 38 times more likely to die from the cold, from the exposure, than the general population. But we took care of a lot of folks who lost, fingers and toes and below the knee amputations. And I think that just continues to be a driver for we need to do better. Yeah. Right?
A big crisis coming across the country. We saw it in Kensington. We saw it yesterday. We went out with a street medicine team.
Yeah.
And there was a couple, married couple in wheelchairs, and they're each missing a leg from xylazine. Mm-hmm. And, the public, many people, there's a growing recovery first movement where they basically want to force people into treatment. There was a gentleman yesterday said something. I asked him how many times has he been in treatment, and he says, more times than I have fingers and toes. So treatment is important, but first, there's not enough treatment for the people that voluntarily want to go into treatment. Yeah. So this whole recovery first thing is so scary to me.
Right.
Because they just hate housing first for whatever reason, threatening or political agendas, or they're just pushing criminalization. And, treatment is important, harm reduction is important, and housing. And if you put them all together, you have the best outcomes. So if it's really about helping people and people that are addicted to drugs, who in their right mind would have a limb amputated, and the first thing they do when they get out of hospital is go use xylazine again? But that's what's happening time and time again, because it's not just something, it's not a switch that you can shut off. You have to treat the person, whatever trauma they're experiencing from homelessness or that drove them to homelessness, now with missing a limb, right? They want to escape from that, so they use drugs, and then drugs takes over and it's just this really horrible cycle.
Yeah, we worked really hard at the Medical Respite Center, which was a program between Cook County Health and Housing Forward, a homeless services agency on the west and the western suburbs, around creating low barrier medical respite, right? A place for people to come as soon as they were exiting from the hospital. We had partnerships with medically assisted treatment recovery agencies, so folks had access to MAR drugs. We took care of folks who were on IV antibiotics because of infections from drug use. And so I think that really, but there aren't a ton of low barrier medical respite programs. So that's something that we are investing in at the state. So we started a medical respite capacity building initiative. Most of our medical respite beds were in Chicago and Cook County, not across the state. And we know from Cairo, which is at the very southern tip of Illinois up to the Wisconsin border, that folks need access to that type of, first, of course, housing, right, as a pathway to housing. But while we are still, I think this is the piece of we have to work on both at the same time. While we are building more opportunities for housing, we also need to strengthen our safety nets.
And the problem is they're pushing against the housing piece to force people into treatment that doesn't even exist, right? Yesterday, same tent camp we were at, there was a gentleman named Patrick. He'll most definitely be in the documentary. And his leg was really hard to look at, and I would assume be close to amputation. And he's the gentleman that said, I was been in recovery more times than I have fingers and toes. And our producer, Alex, asked him, would housing help? Why did these multiple times of treatment not work? And would housing help? And of course it would, because then all these other issues of poverty and cold are not so much a factor that you can start healing.
Right. No one should become permanently disabled because they are unhoused. And that is what happens, right? And I think that this is our action call, right? That we as a society need to do better in really understanding how we support folks.
What are the bright spots? What are you seeing that's doing good? And it could be Chicago or it could be nationally.
Well, I feel like what is bright is that we are coming together as in community. We have a community that is fighting back about what is happening at the federal level. I feel incredibly grateful to be in Illinois and to, have a governor and work within an administration that is actively fighting back against regressive policy. And so I'm very hopeful with that. My husband is the executive director of a supportive housing agency. So we talk a lot about this work.
Yeah, I'm sure.
And I think that just the passion that happens at all levels, right, of people who were coming together. I went to one of the protests. Chicago had a very large protest a few weeks ago. And I can't tell you how many people that we recognize from the field who are out in the streets and who are fighting back for what we're seeing as the destruction at the federal level. And I think that's what we're called, that there is a movement. I think the one thing that I think about a lot is when we talk about ending homelessness, I really thinking about how can we bring rates of Black homelessness down to rates of white homelessness. Yeah. If we can do that and really think about root drivers of white homelessness as well as Black homelessness, I think that's how we get there. Because if we had the same rate of Black homelessness as white homelessness in Illinois, we'd have enough of a safety net to serve everyone. Yeah. So if we don't solve this problem, we aren't going to end homelessness. And there's a way, and specifically with the court-based rental assistance, where it was rooted in what we understood of the needs of Black communities, but it serves everyone. It serves white communities, brown communities, all communities receive the supports, but it's policy that centers the Black experience. And for us, that's the majority of people.
You brought up a really good point Ian DeJong, who's been on this podcast multiple times, we talk about how we need new benchmarks of success. And that could be one, bringing, because in 40 years, over 40 years, there's been some small successes, but we haven't significantly solved homelessness. But yet we keep saying, we're ending homelessness, we're ending homelessness. And if we created new benchmarks, new metrics, new ways to communicate success, not just to the public, but to ourselves, I think it would be so not just productive, but help us emotionally and just be a smart way to go. Now, I never thought of any practical metrics until what you just said.
Yeah. And that's, I think, where we need to get to. And I think that the challenge of that right now is that at the federal level, service providers are told you can't be talking about diversity, equity, and inclusion. So if you can't say Black, and you can't say brown, and you can't say woman, and you can't say LGBT, like, we have to still be able as a sector to be able to talk about the needs of Black people, right? Like, we can't, I think that there is that understanding of and that challenge that providers have right now, right? And they're telling us, because folks are applying for funding at the state level, where at the state level we say, please tell us what are your equity efforts. Right. And then they apply for federal funding, or their federal contracts say, no, we don't talk about that. So there is a conflict, and I do think we need to figure out how to address it. But it's part of within our brains, within our content. If we don't center the experiences of Black people, then we're not going to end homelessness.
Anything you'd like to add?
Thank you for the opportunity to talk. I mean, I think that it is exciting for us to have this opportunity to really talk about narrative change, especially around, as we're talking about Black homelessness. I think talking about connections between housing and health, but that it's frightening that our numbers continue to increase, right? And at this time, where there's so much uncertainty at the federal level, I appreciate this podcast because it allows us to really be thinking about and hearing from other leaders across the nation about how they're thinking about how to change systems. And I hope that we can add to that.
Oh, you already have. What's different about us is because our only political agenda is to prevent and solve homelessness and to be kind. We're known for authenticity, so people can speak more freely. And I think that is what's helped these conversations grow, because guests can be open and honest here. They can talk about things that they might not be able to talk about in other podcasts because there's an agenda behind it. And I'm very much excited, but I love meeting people like you. And I do love all you people that are listening or watching right now. Well, thank you very much for joining us.
Thank you so much for the opportunity, Mark.